Ciprofloxacin, uses, side effects, dosage, precautions, and more. Ciprofloxacin, a fluoroquinolone antibiotic, treats various bacterial infections and is also used for anthrax or certain types of plague exposure. Ciprofloxacin extended tablets are approved only for adults. Ciprofloxacin is used for treating some serious infections when other antibiotics are not able to work. The brand name of this medication is Cipro. What is ciprofloxacin? Ciprofloxacin is a broad-spectrum antibiotic belonging to the fluoroquinolone class that works by killing bacteria that cause infections. It is effective against both gram-positive and many gram-negative bacteria. Ciprofloxacin is an antibiotic that belongs to a group of antibiotics called fluoroquinolones. It works by killing the bacteria that causes an infection. Ciprofloxacin is a broad-spectrum antibiotic, which means that it's used to treat a number of bacterial infections. The medication is only available on prescription and comes as tablets, a liquid that you drink, ear drops and eye drops. What are the benefits and uses of ciprofloxacin? Ciprofloxacin demonstrates excellent effectiveness against a wide range of bacterial infections, making it a valuable treatment option when other antibiotics may not be suitable. The medication shows particularly strong activity against gram-negative organisms. Conditions ciprofloxacin treat. Ciprofloxacin is used for treating various bacterial infections. It belongs to the class of drug called quinolone antibiotics. Ciprofloxacin tablets work by stopping the growth of bacteria. The medication is used for treating bacterial infections such as chest infections, skin and bone infections, sexually transmitted infections, conjunctivitis, eye infection, ear infections, urinary tract infections, UTIs, respiratory infections, such as pneumonia or bronchitis, bone and joint infections, gastrointestinal infections like traveler's diarrhea, intra-abdominal infections. Secondary uses of ciprofloxacin. The medication is used to stop people from getting meningitis. Ciprofloxacin is also used to treat or prevent plague and may be used to help treat tuberculosis and Crohn's disease. In the event of biological warfare, ciprofloxacin may be used to treat and prevent dangerous illnesses that are deliberately spread, such as tularemia and anthrax of the skin or mouth. How does ciprofloxacin work? Ciprofloxacin works through a specific mechanism that targets essential bacterial processes, making it highly effective against various bacterial infections. The bactericidal action results from inhibition of critical bacterial enzymes. The bactericidal action of ciprofloxacin results from inhibition of the enzymes topoisomerase II, DNA gyrase, and topoisomerase IV, both type II topoisomerases, which are required for bacterial DNA replication, transcription, repair, and recombination. Ciprofloxacin binds to bacterial DNA gyrase with 100 times the affinity compared to human enzymes, making it selectively toxic to bacteria while minimizing effects on human cells. Dosage of ciprofloxacin. Ciprofloxacin is available in tablets, liquid, and extended-release forms for oral administration. Tablets and liquids are usually taken twice daily, while extended-release tablets are taken once daily. Treatment duration varies based on infection type and severity, as prescribed by the doctor. Take it at the same time daily and follow the doctor's instructions carefully. Avoid dairy products or calcium-fortified juices while taking it. Swallow extended-release tablets whole, and shake the liquid well before use. Ciprofloxacin adult dose. For adults, the typical ciprofloxacin dosage varies based on the type and severity of the infection. For urinary tract infections, UTIs, the usual dose is 250 mg to 500 mg taken twice a day for 3 to 14 days, depending on the severity of the infection. For respiratory infections, the recommended dose is 500 mg to 750 mg, taken twice a day for 7 to 14 days, depending on the infection type. For skin infections, the usual dosage is 500 mg to 750 mg every 12 hours for 7 to 14 days, based on infection severity. For gastrointestinal infections, the dose is typically 500 mg, taken twice a day for 5 to 7 days. For bone and joint infections, the recommended dose is usually 500 mg to 750 mg twice a day, typically for 4 to 6 weeks. Ciprofloxacin Kids Dose. The ciprofloxacin dosage for children is carefully based on the child's weight and the type of infection being treated. For urinary tract infections, UTIs, the typical dose is 10 mg per kilogram of body weight, taken twice a day. For respiratory or skin infections, the usual dose is 10 mg to 20 mg per kilogram of body weight, taken twice a day. For infections caused by anthrax or plague, the dosage is generally 10 mg per kilogram every 12 hours. Important notes. Always follow the doctor's prescription to avoid overuse or underuse. Take the full course of ciprofloxacin, even if symptoms improve before completion. Ciprofloxacin should not be used in children under 18 for most conditions unless specifically directed by a healthcare provider. If a dose is missed, take it as soon as possible, but do not double the next dose. How to use ciprofloxacin eye drops? The doctor would ask you to put 1 or 2 drops in the affected eye 4 times a day. In the case of severe infections, the doctor may tell you to use the drops every 15 minutes for every 6 hours. What should I do if I miss a dose? Missing 1 or 2 doses of ciprofloxacin typically has no effect, and skipping doses usually poses no problem. However, timely dosage is crucial for some medications to work effectively. If you miss a dose, your doctor may advise taking it as soon as possible to prevent sudden chemical changes in your body. What happens if an overdose? Overdose of a drug can be accidental. If you have taken more than the prescribed tablets, there is a chance of getting a harmful effect on your body's functions. Overdose of a medicine can lead to some medical emergency. In case of overdose, get medical help or contact a poison control center immediately. What are the side effects of ciprofloxacin? Ciprofloxacin side effects can range from mild gastrointestinal symptoms to serious adverse reactions that require immediate medical attention. The most common ciprofloxacin side effects are nausea, vomiting, and diarrhea. Common side effects of ciprofloxacin: nausea, vomiting, diarrhea, headache. Liver function tests. Serious side effects of ciprofloxacin: severe stomach pain, diarrhea, skin rash, urination, irregular heartbeats, muscle weakness, jaundice, increased pressure inside the skull. If you experience serious symptoms, contact your doctor promptly. If you have any reactions, avoid using it. While the majority of users do not experience side effects, if you encounter serious side effects, seek immediate medical attention. Precautions and warnings. Fluoroquinolones have been associated with disabling and potentially irreversible serious adverse reactions including tendinitis and tendon rupture, peripheral neuropathy, and CNS effects. Discontinue the drug immediately and avoid use of systemic fluoroquinolones in patients who experience any of these serious adverse reactions. Before taking it, consult a doctor if you are allergic to it or any other medications. The product may contain some inactive ingredients that can cause various allergic reactions or some other problems. Before using the medications, talk to your doctor about all the medical history, especially heart problems, joint problems, seizures, blood vessel problems, genetic conditions, nerve problems, high blood pressure, diabetes, kidney disease, liver disease. Ciprofloxacin can lead to QT prolongation, affecting heart rhythm and causing symptoms like irregular heartbeat, dizziness, and fainting. Are there any age restrictions for using ciprofloxacin? Ciprofloxacin is generally not recommended for children under 18 years of age, except for certain conditions like cystic fibrosis or anthrax exposure due to risks of joint problems. Ciprofloxacin may pose risk during pregnancy and breastfeeding, and it should only be used if necessary and prescribed by a doctor. Ciprofloxacin can lead to QT prolongation, affecting heart rhythm and causing symptoms like irregular heartbeat, dizziness, and fainting. May exacerbate muscle weakness in patients with myasthenia gravis. Avoid fluoroquinolones with known history of myasthenia gravis. Possible interactions with other medications. Drug interactions. Drug interactions can alter how medications work and increase the risk of serious side effects. Ciprofloxacin may interact with products such as warfarin, strontium, and acetocomerol. Ciprofloxacin may interact with products such as warfarin, strontium, and acetocomerol. Keep a list of all products you use and share it with your doctor to prevent potential interactions. Using this medicine with any of the following medications is not recommended. Your doctor may choose not to prescribe this treatment or may modify your other medications. Lamidopide, mesoridazine, pimozide, piperquine, ziprasidone, agomelatine, Bacterial, cisapride, sequinavir, sparfloxacin, terfenadine, thioridazine, tizanidine, dronedarone, solanetine, flibanserin, levoketoconazole. Ciprofloxacin can interact with certain mineral supplements, such as calcium, iron, magnesium, and zinc. Taking these supplements around the same time of day as ciprofloxacin can prevent your body from absorbing ciprofloxacin correctly. To avoid this interaction, you should not take these supplements in the 6 hours before and 2 hours after taking a dose of ciprofloxacin. How should ciprofloxacin be stored? Store ciprofloxacin away from heat, air, and light to prevent damage, and keep it out of children's reach for safety. Keep this medication in the container it came in, tightly closed, and out of reach of children. Recommended storage temperature for ciprofloxacin. Ciprofloxacin tablet should be stored at room temperature between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. Store the tablets and extended release tablets at room temperature and away from excess heat and moisture, not in the bathroom. Store the suspension in the refrigerator or at room temperature, closed tightly, for up to 14 days. Ciprofloxacin contraindications. While ciprofloxacin is effective for many bacterial infections, there are certain situations where it should not be used. Hypersensitivity to ciprofloxacin or any fluoroquinolone. People who are allergic to ciprofloxacin or related antibiotics should avoid using it. Children under 18 years of age. Ciprofloxacin is generally not recommended for children, except for certain conditions like cystic fibrosis or anthrax exposure due to risks of joint problems. Pregnancy and breastfeeding. Ciprofloxacin may pose risks during pregnancy and breastfeeding, and it should only be used if necessary and prescribed by a doctor. Tendon issues. Ciprofloxacin can increase the risk of tendonitis and tendon rupture, especially in individuals over 60 or those using corticosteroids. Severe liver or kidney disease. People with severe liver or kidney problems should be cautious, as ciprofloxacin is processed through these organs.